Residents are doctors who want additional education or who want to qualify for a specialty board so they can become specialists. They have to spend 3 or 4 or even 5 years after their internship before they can qualify as specialists.
Boy, that's a long stretch, isn't it?
Residency today is quite a bit different from what it was in the 1950s. Rhode Island Hospital started training interns and residents in 1868, just 3 years after the Civil War ended, which is amazing. By the time the 50s hit, we'd trained in total about 600 residents during that time period, so from 1868 to the 1950s. We currently train 600 residents every day at Rhode Island Hospital. So what we did over a period of almost a century, we now do literally in a day. Residency training and fellowship training have become more and more specialized, and they've allowed for people to do many, many things that weren't available to them for job prospects and for professional reasons in the 1950s.
These young students have had a whole year's or more of training where they use all these texts. A year in pharmacology alone is a textbook they use.
And they actually cover this whole thing, this great stack in 1 year?
No, this is a 3-year training
I
program
see.
combined with clinical experience in the hospital, but this is the academic part.
3rd and 4th years of medical school, after learning all the book knowledge that you can about the human body and diseases and how we treat them, you then spend time in hospitals and in doctors' offices learning obstetrics, learning psychiatry, learning medicine, learning surgery, and then in your 4th year, you learn what you really would like to do. When you start residency training, you've picked a specialty. You know you want to be a surgeon. You know you want to be an emergency room physician. You know you want to be a pediatrician. There's no rotating anymore, but you specialize in what you've always wanted to be. Fellowship training is an additional 1 to sometimes 3 years of training after you finish your residency to become specialized in an even more specialized area. For instance, I trained in internal medicine as an internist. That's a 3-year residency program. After that, I trained in infectious diseases in a 2-year fellowship program.
Well, how much time in each day is devoted to this? Well, education is the word I use again.
Well, we can divide our time up actually into so-called didactic formal teaching rounds, which we conduct 2 or 3 times a week with lectures and demonstrations. The remaining portion of the time when we're on duty here, which usually runs on a 36 or 48-hour stretch, we are on duty around the clock. We could be called out any time of day or night. We stay right here on the hospital grounds and sleep here.
They were called residents because they literally resided here. And so what would happen from your day-to-day life is that you would be on call every other day, and you would spend overnight in the hospital. You would get up in the middle of the night to go make rounds if that was the appropriate thing to do, and the next day you would often go in and check on your own patients. So being a resident was your life.
I bet you were just about to start on rounds, were you?
That's right. Would you like to go with us?
I'd love it. You mean it? Come on, let's go. I'd love that.
Dr. Gibson, what progress has Margaret made this week?
Well, as you saw by the x-rays last week, the proximal fragment had slipped a little bit, so we have changed the traction. Most recent x-rays show that the leg is in good position.
All right. Are you pretty comfortable?
Very comfortable.
Well, now, Dr. Burton, is it standard that the intern or resident reports to you on the progress of the patient as you come in on these rounds?
That's right.
Does the intern or resident see the patient routinely, more frequently than you?
Well, they see them every day, sometimes more than once a day, depending on how sick the patient is.
Rounds are much more diverse. Rounds are much more frequent. They happen every day, sometimes more than once a day on services where people are quite sick, like intensive care units. And the attending physicians don't simply come in to help out the residents. We're a team taking care of patients together. And I think that is a very different paradigm than what happened just 50 or 60 years ago.
We have all the new ideas from the house staff and as a result of their reading and their recent teaching, and that is balanced against the experience of the older men who have seen many of these things before, and the outcome is usually a good result for the patient.
When I look out on the first day of orientation and look at the audience, the notion that they would be all men, all in white uniforms with white socks and shoes like in the video is completely gone. It's a very, very diverse group. Our residency and fellowship class for this entering class is actually 52% women. And women are in all kinds of specialties. Each year, when residents graduate and fellows graduate, we have a handful who decide to stay in Rhode Island. I think many of them love the many things that we all love about living in Rhode Island, so that it is the state in and of itself, and I think the hospital and Brown are a reason for people to want to stay.